Hello, friends. How are you? Welcome back to our channel Hospital Administration. From the chapter Organizational Behavior, today we are discussing about one of the most important topic, that is happy workers are productive workers. Do you think so? Then let's go. The statement happy workers are productive workers is one of the most discussed ideas in organizational behavior. It originated from the Hawthorne studies in the 1930s, which suggested that improving working conditions increased employees' happiness and in turn productivity. This is actually a psychological and operational ripple effect. Happiness enhances the job satisfaction, and emotional well being buffers against burnout. When healthcare professionals feel supported and satisfied, their cognitive load is reduced, leading to the higher clinical precision and improved soft skills like empathy, which are proven to accelerate patient recovery. While an early 1980s review questioned the strength of this link, more recent meta-analysis of over 300 studies show a moderately strong positive correlation between job satisfaction, means happiness at work, and job performance. This relationship is particularly relevant in the healthcare sector, where employees like doctors, nurses, technicians deal with high stakes, emotionally demanding work. In hospital, happy workers can directly translate into better patient outcomes, fewer medical errors, and improved institutional efficiency. How it give a better patient outcome, better emotional support leading to faster recovery times and higher patient satisfaction scores. This lead to fewer medical errors. The high job satisfaction lead to improved cognitive focus and significantly fewer medical mistakes. And how it improve the institutional efficiency, it lower the burnout rates, ensure consistent care, reducing high costs associated with staff turnovers. In healthcare, the link between happiness and productivity is not just theoretical, it has practical and measurable impacts. Let's look. Higher motivation and quality of care is only get after a satisfied job. Satisfied healthcare professionals show greater engagement, compassion, and attention to detail. For instance, happy nurses are more likely to follow protocols carefully, communicate effectively with patients and families, and collaborate with doctors. This reduces medication errors, improve patient satisfaction scores, and enhances overall quality of care. Another idea is it reduces the burnout and absenteeism. Happiness acts as a buffer against the burnout. A major issue in hospitals, satisfied staff report lower emotional exhaustion, take fewer unplanned leaves, and maintain consistent performance even during peak hours or emergencies. The CDC data shows that positive working conditions which foster happiness significantly lower burnout rate among the health workers. Next is better teamwork and innovation. Happy workers are more helpful and innovative. In a hospital setting, this means proactive problem solving, knowledge sharing, and willingness to mentor juniors, all of which improve the team efficiency and clinical outcomes. Then empirical evidence. Oxford University research found happy workers are 30% more productive overall. That studies specific to healthcare show that higher job satisfaction among hospital doctors and nurses correlate with better perceived hospital performance and higher quality of patient care. Work engagement, a key part of happiness, moderates the relationship. Engaged and satisfied nurses perform tasks more frequently and with better quality. Even though the statement is largely valid, it is not absolute. The relationship is actually two-way and follows certain conditions. One is the satisfaction can lead to better performance, but high performance also bring recognition, promotion, and intrinsic pride, which further increase happiness or satisfaction. In healthcare, a doctor who successfully handles complex cases feels accomplished, reinforcing satisfaction. Another is inverted U shaped relationship. Too little challenge, boredom, or too much stress or work harms the productivity. Moderate level of challenge combined with happiness create peak performance. In hospitals, balanced workload with supportive environments yield the best result, while chronic understaffing turns happiness ineffective. Moderating factors. The link is stronger in complex jobs, example critical care or surgery, where staff have autonomy. External constraints like severe resource shortages or heavy patient loads can weaken the relationship. Gender, income, and patient load also influence outcomes. Female nurses and higher income staff often report stronger satisfaction performance links. Next is a real world healthcare example. During high pressure period, example pandemics or peak seasons, hospital with high staff satisfaction showed lower turnover, fewer error, and better patient recovery rates compared to those with dissatisfied staff. Conversely, dissatisfaction lead to presenteeism, working while unwell, which comprises safety. It compromises safety. Then look to the inverted U-shaped relationship. In the left side, we can see the low satisfaction because of the low motivation, errors, and absenteeism. The middle peak, that is a moderate, high satisfaction, manageable challenge, highest productivity, and best patient care. The right side is extreme pressure without support, that goes burnout despite initial happiness from the purpose. So, conclusion, the happy workers are productive workers. That statement is largely valid and highly relevant in healthcare. Happy doctors and nurses deliver safer, more compassionate care, reduce organizational cost through lower turnover, and contribute to better hospital performance. However, hospitals must actively create enabling conditions like fair rewards, supportive leadership, adequate staffing, and autonomy to fully realize this benefit. In an industry where lives depend on human performance, investing in employee happiness is not just good management, it is a clinical and ethical necessity. Thus, the statement holds strong when supported by proper organizational practices.